Uganda conducting massive COVID-19 vaccination drive. As the cogs of the tourism sector slowly but steadily begin to turn, stakeholders from the Uganda tourism sector desperate to return to pre-pandemic days have taken pragmatic steps in a bid to revive the sector. Several private companies and associations have banded together to set a massive vaccination drive in motion in Uganda. In addition, coronavirus testing procedures are being tightened up and streamlined. Fully vaccinated travelers upon showing proof may be exempt from testing upon arrival. This is happening as the Ministry of Health (MO) updated its response to the COVID-19 pandemic guidelines presented by Dr. Henry G. Mwebesa, Director General Health Services (MO), on May 27, 2021. Leading by example, the Association of Uganda Tour Operators (AUTO), Uganda Guides Association (UGA), Uganda Safari Guides Association (USAGA), Uganda Tourism Board (UTB), and Uganda Wildlife Authority (UWA) embarked on a massive vaccination drive at the Uganda Museum in Kampala from June 2, 2021. By close of day, 330 persons had received the jab. The Ministry of Health signed a Memorandum of Understanding with the Association of Uganda Tour Operators to carry out sample testing in a comfortable manner and to return results to their clients within an hour of testing as opposed to the required 4 hours. According to AUTO Chair, Sivi Tumusim, following a series of meetings with MO, vehicles can also pick up their clients in company vehicles as opposed to boarding them into buses with other travelers, get them tested, and then transfer them to their hotels where they can fast-track results. Other travelers from Category 1 and 2 countries including children have to be transferred by bus to Peniel Beach Hotel located 2 kilometers away where sample removal and testing is done. To this end, following MO guidelines, travelers from Category 2 including the USA, United Kingdom, United Arab Emirates UAE, Turkey, South Africa, Kenya, Ethiopia, South Sudan, and Tanzania including Ugandan nationals shall be subjected to a PCR test at points of entry at their own cost. Travelers from Category 2 that have been fully vaccinated and have proof of vaccination to attest to this shall not be required to undergo the mandatory PCR testing on arrival. This exemption from COVID-19 testing is premised on a growing body of scientific evidence from the Centers for Disease Control and Prevention (CDC) of the USA which shows that people who are fully vaccinated are less likely to present with symptoms and to spread the virus that causes COVID-19. As such, vaccination is seen as a strong tool to control the virus, and many countries are using vaccinations to control COVID-19 transmission. Based on this, travelers from countries that have achieved 50% coverage or at least one dose of COVID-19 and present full proof of vaccination upon arrival will be exempt from mandatory PCR testing upon arrival at the airport. Travelers from countries that have not achieved 50% coverage and have not received at least one dose of the COVID-19 vaccine shall be required to undergo mandatory PCR testing at their own cost upon arrival at the airport or at other points of entry. The current mandatory testing from countries in Category 1 and 2 has enabled the country to curb the spread of variants. Testing of travelers arriving through land borders without test certificates from recognized laboratories shall be intensified based on the epidemiological picture of the pandemic. The Ministry of Health categorizes countries based on the current global trend of the COVID-19 pandemic, according to the risk they pose, according to the variants of concern, the high rate of transmission, deaths reported in the past 3 months, and coverage of vaccination. The categorization is reviewed every week according to the epidemiological picture of the pandemic globally. India is the only country in Category 1 where all flights and passengers originating from India were suspended as of May 1, 2021, 23:59 hours. In Category 3 are travelers from the rest of the countries who do not present with symptoms of COVID-19 and who are exempted from the above measures. The Ministry of Health has assured tour operators that there shall be no lockdown. Tour operators shall, however, have every reason to remain edged to their seats as President Yoweri T.K. Museveni gives another of his dozen-plus anecdotal nationwide live addresses on Sunday, June 6, at 2000 hours local time on the course of action following the recent spike in cases. Several have already received confirmed bookings in June and can barely afford to wait out another high season without business. Cumulative cases since the start of the pandemic are 49,759. Cumulative recoveries are 47,760. Active cases on admission at health facility are 522. New cases are 1,083, and there have been 365 deaths. To date, 4,327 travelers entering Uganda from Category 1 and 2 countries through Entebbe International Airport have undergone testing for COVID-19. Out of these, 50 of the samples turned out positive and were transferred to COVID-19 isolation units. The confirmed cases originated from 8 countries include UAE 16, South Sudan 15, Kenya 6, USA 6, Eritrea 3, Ethiopia 2, South Africa 1, and the Netherlands 1. Rebuilding travel.